What if I told you there's a simple 3-minute technique that could potentially prevent permanent brain damage during a stroke? We're going to walk through a practical, life-saving action plan that could make all the difference in that absolutely critical moment. So let's picture this. It's a completely normal Tuesday morning. A 68-year-old woman, let's call her Margaret, is in her kitchen just making a cup of coffee. There's no warning, no pain, just this sudden, quiet shift in her entire reality. The coffee cup just slips from her hand. She tries to pick it up, but her left arm doesn't respond at all. When she tries to call out to her husband, the words just don't work. They come out all broken and scrambled. One side of her face starts to droop. She is, right then and there, having a stroke. But what Margaret did next, in that tiny window before the ambulance even arrived, that's the most important part of this story. It was a shockingly simple act that an ER doctor later said probably saved her from permanent brain damage. So what on earth did she do? And Margaret's story brings us right to the heart of the matter, a stroke's first few minutes. You see, what happens in this incredibly brief period can literally determine everything that follows, from lifelong disability all the way to a full recovery. Now, a lot of the time, a major stroke doesn't just happen out of the blue. It can be preceded by something called a transient ischemic attack, or TIA. The easiest way to think about it is this. Your brain is like a city at night. A TIA is when the lights flicker in one neighborhood. It's a warning. It is your brain pulling the fire alarm. It is not a false alarm. And this, right here, is the crucial point. When those symptoms fade, maybe a numb arm suddenly feels fine again, a lot of people just relax. They think the danger is past. It hasn't. The moment that symptom disappears, it doesn't mean you're safe. It means the clock has officially started ticking. Okay, so how do you recognize these signals? I mean, how do you learn to tell the difference between just a harmless sign of getting older and a genuine, time is of the essence, distress call from your brain? Well, once you know what to look for, the difference is actually pretty clear. You know, feeling a little lightheaded after you stand up too fast? That's usually nothing. But sudden, intense dizziness while you're just sitting still, that is an emergency signal. Forgetting where you put your keys is normal, but suddenly being unable to put a coherent sentence together, that's a critical warning. These are the big ones, the primary red flags. If you or anyone you're with experiences any of these, it is time to act immediately. Sudden numbness, trouble speaking, a drooping face, vision problems, loss of balance, or a really severe sudden headache for no reason. Even just one of these is enough. You know, there's this huge psychological barrier too, that this quote just nails. There's this cultural instinct, especially in older folks, to not complain, to not make a scene. But when it comes to a stroke, that quiet stoicism, that whole I'll just push through it mentality, it can be absolutely deadly. Waiting even a few minutes to see if it passes can be the difference between recovery and permanent damage. Okay, so you've recognized the signs. What is the very next step? This is it. This is the life-saving technique we've been talking about, a proactive, scientifically validated response you can start doing immediately. The very first step, before you do anything else, is to not panic. And listen, this is physiological. It's not just psychological. When you panic, your breathing gets shallow and your blood vessels tighten up, which is the exact opposite of what your brain needs. It literally robs your brain of precious oxygen at the worst possible moment. So here is the 3-step process. It's called gravity-assisted blood flow. First, get horizontal. Lie flat on your back to prevent a fall. That's priority number 1. Second, elevate the legs about a foot, 12 inches, with some pillows or cushions. This uses simple gravity to help redirect blood from your legs toward your brain. And third, and this is maybe the most important part, breathe. This is where you take back control. And that breathing, it has a specific rhythm, a 4-2-6 pattern. It's simple. You inhale gently through your nose for 4 seconds, hold that breath for 2 seconds, and then exhale slowly through your mouth for a full 6 seconds. This pattern does 2 things. It super oxygenates your blood, and it calms your entire nervous system. And look, this isn't just a theory or some folk remedy. A 2022 study in the Journal of Emergency Neurology found that patients who used this exact method showed significantly lower levels of permanent brain cell damage. Now, this doesn't replace calling 911. You absolutely have to do that, but it buys the brain critical, precious time. This immediate care is so important because it's the very first step toward recovery. Because even after a stroke happens, believe me, the story isn't over. The brain has this incredible, almost magical ability to heal itself, and it's all thanks to something called neuroplasticity. Think of it like this. If a major highway in a city gets blocked, traffic doesn't just stop forever, right? No, the city reroutes it. Side streets suddenly become main roads. Well, your brain does the exact same thing. It finds new neural pathways to bypass the damaged areas. And what signals the brain to start this amazing rebuilding process? Gentle, intentional movement. Research shows that seniors who engage in slow, rhythmic movements after a stroke are twice as likely to regain critical functions like their balance and their memory. Twice as likely. That's huge. But of course, the ultimate goal here is to prevent a stroke from ever happening in the first place. And this brings us to some simple but really powerful daily habits that support your brain health and circulation long before any danger ever shows up. Here's a 3-minute routine you can do the moment you wake up. First, just sit on the edge of your bed and take 3 nice, slow, deep breaths. Then, for 1 minute, pump your calves up and down. This activates a muscle that's often called the body's second heart because it helps push blood up from your legs. Finally, just do some gentle rotations for your shoulders and neck. It's so simple, but it really improves morning blood flow. And of course, we have to talk about nutrition. It's a game changer. A Harvard study found that seniors on a Mediterranean-style diet had a 30% lower risk of having a second stroke. That's not a small number. That is a fundamentally different future, guided by what's on your plate. Which brings us right back to Margaret in her kitchen. By the time the paramedics arrived, something remarkable had already happened. Her speech was starting to come back. Her calm, purposeful actions, lying down, raising her legs, and breathing, gave her brain the exact support it needed in that crucial window. And that really is the ultimate takeaway here. True health isn't about some naive hope that you can avoid every crisis. It's about having the knowledge and the readiness to act effectively when one shows up. It's about transforming panic into purpose. So the real question is, are you prepared? Please share this knowledge, practice it in your mind, because the life it protects could be someone you love or even your own.